Hi everyone! Today let's talk about PMS and menstrual discomforts. Now, cramps, fluid retention, and occasional moodiness that a lot of women experience before and during menstruation may actually just be an indication that your reproductive system is actually just following its natural, healthy, and cyclic changes that is actually characteristic of a healthy reproductive system. Now, however, there are other changes that may not be that healthy. In fact, our menstrual cycle can trigger an array of emotions and symptoms that a lot of women struggle with and are feeling at a loss in terms of managing these symptoms. And with the wide array of symptoms and signs that actually are related to the menstrual cycle, we need to realize that there is no cure-all. The good news is there are a lot of research already that have identified more than 300 possible remedies for all these symptoms that can actually help women survive this period in their cycle. And in this video, I will be mentioning some of the remedies and hopefully they will work for you. First, let's talk about what causes the pain. So every month during your reproductive years, there are a lot of activities that actually happen in your reproductive organs. Okay, what happens is initially a single egg is released from the ovary and it travels up to your uterus and waits there for a sperm for a possible fertilization. Now, while the egg is waiting, the ovary then releases estrogen and later on progesterone, and these two actually hormones now work together to actually make the lining of the uterus thicker, and so this actually prepares the area where the egg will eventually embed in case a fertilization happens, and eventually the baby will stay there in that area. Now, during this time, the woman is not only physically ripe, but she is also emotionally and intellectually at her best. Now, when an egg remains unfertilized, the uterine lining now begins its monthly regenerative ritual by releasing blood vessel constricting substances called prostaglandins. Now, these substances now actually cause contractions that slowly release the uterine lining, or it causes a sloughing off effect, okay? And this actually now triggers the occurrence of cramps that may start actually a week before your menstruation and actually, continue until the end of menstruation. Now, because these prostaglandins have anti-inflammatory and pain-causing effects, some women may also experience bouts of nausea, bloating, headache, diarrhea, and breast tenderness. Now, sometimes even small things can actually cause a profound effect on how you feel. And many women throughout time have actually treated PMS and menstrual discomforts with home remedies that are simple, tested, and have been passed on from generation to generation. Here are actually three very popular home remedies that you might want to try. Number one, take ibuprofen right away. Ibuprofen actually prevents the production of pain-causing prostaglandins. Now, if you take the ibuprofen at the first sign of the symptom, this actually now helps you sustain a protective level of the medicine in your bloodstream, thus preventing the worsening of the symptoms later on. Now, I would advise you to take 400 milligrams of ibuprofen at least 4 times in a day, starting from at least 1 to 2 days before your menstruation starts, until the day that all the symptoms actually disappear. Number 2, water down bloating. Okay, now fluid retention can actually cause a lot of discomforts in terms of feeling of swelling of the breast, of the abdomen, and of the ankle. Now, it sounds paradoxical that you should drink more water when you feel like a sponge. But you have to remember that according to Dr. Killens, who is actually a co-author of the book 5 Steps to a PMS-Free Life, and who is actually a professor of the Department of Obstetrics and Gynecology of the Keck School of Medicine of the University of Southern California, water actually acts as a diuretic, which actually helps remove excess fluid from the body. So what we actually advise is drinking 8 full glasses of water daily before and during your menses. Number 3, avoid cigarette smoke. Now, research has shown that even secondhand smoke can actually make premenstrual symptoms worse. Now, there was a study done in China wherein they studied 165 newlywed women who were non-smokers and who did not experience any premenstrual syndrome. Now, 6 months after with exposure to secondhand smoke from their husbands, it was noted that these women now started experiencing actually premenstrual lower back pains and abdominal bloating. Now, it's a known fact that estrogen actually plays a role in the regulation of the metabolism of certain key nutrients in the body, and it also actually affects how the body absorbs them. In fact, new evidences have shown that levels of calcium, vitamin D, iron, and other key nutrients actually rise and fall with the fluctuation of estrogen. Some research even say that these temporary nutritional deficiencies may actually be the culprit of some of the premenstrual symptoms that women are actually feeling and that have actually left doctors perplexed for many decades now. Moreover, more than 10 major studies have already shown actually, for example, that supplementing the diet with calcium or vitamin B6 help relieve both premenstrual and menstrual symptoms in women who are not getting adequate amounts of these two nutrients. But, okay, supplements can only do so much. Women have to actually get or eat a healthy diet and then try to maintain the ample amount of vitamins and nutrients throughout their lives and not just during the premenstrual and menstrual phase. So what are the nutritional advices that you can actually follow to avoid or to actually decrease and manage premenstrual syndrome and menstrual discomfort? So number 1, nutritional treatment is get enough magnesium and vitamin B6. Now, one of the reasons why these two are actually highly recommended in the management of PMS and menstrual discomfort is that these two actually help assure a healthy supply of the mood-regulating brain chemicals serotonin and dopamine. Research have actually shown that these chemicals, called neurotransmitters, also play a role in easing or preventing physical symptoms like bloating, headache, acne, and cramps. Now, you can get a lot of magnesium and vitamin B6 in raisin, corn, and banana. However, if you really want to supplement, you can, to be on the safe side, you can actually just limit your magnesium supplement to 350 milligrams daily and your B6 supplement to 100 milligrams daily. However, the B6 will not be as effective alone as it will be when it is with the other B vitamins. So it's best to actually take B complex. Now, if your breast gets tender as your period approaches, you can actually follow the second step, which is easing your breast pain with a nutritional combo that has been suggested by Dr. Jane Minkin, who is actually a clinical professor of the Department of Obstetrics and Gynecology of the Yale University College of Medicine, and this is what she suggested. Now, according to her, this supplement combination actually now helps ease the pain and inflammation that are triggered by the surges of prostaglandins in the body during your menstrual cycle. Now, many of the food that we depend on for protein, mainly meat and dairy, are also very high in fat, which have been equated to worsening menstrual cramps. And so it's better to focus on 4 better sources of protein. So this is actually the third advice. So focus on 4 better sources of protein, namely fish, okay, soy, egg whites, and legumes. Okay, so I'll repeat that. It's fish, soy, egg whites, and legumes. And they actually provide more than proteins. Your soy and your legumes actually contain phytoestrogens. Your fish contains omega-3 fatty acid, which actually helps regulate mood. And the egg white is a very good source of protein without the fat. Okay, number 4, do not, and I repeat, do not give in to that sweet craving that actually happens before and during menstrual cycles. Now, most women would crave for candies, sweet stuff, baked goodies. Please do not give in to this. Why? Because if you indulge in these kinds of foods, chances are your blood sugar will rise up really high, and it can actually cause both your energy and your mood to crash down, so we don't like that, okay? It's also advised that you don't consume a lot of highly processed carbohydrates like potato chips and sodas, because these only actually provide empty calories. And then if you eat these foods and you feel, it actually makes you feel full eventually, but you don't get the nutrients that you actually need to fight off PMS and menstrual discomfort. So it's a lose-lose situation. Let's now go to the alternative therapies. Now, most women actually experience some kind of premenstrual stress. Now, as it turns out, stress is not only a symptom of PMS, but it can actually be the cause of it. Okay, also. So, when you're stressed, when the body is stressed, the adrenal glands, what does it do? It gets actually your progesterone. Remember what I mentioned before, when your ovary would produce estrogen and progesterone to help regulate the cycle. Now, if you're stressed, what your body does is it now gets the progesterone and converts it to what we call cortisol, which is actually the stress hormone. And this will now mean there's now a lesser level of progesterone. Now, low levels of progesterone are actually the primary culprit of menstrual cramps and PMS. Now, to reduce your risk of suffering from stress-induced PMS, you actually need to develop stress-relieving strategies that you need to do every day. Now, there are some women who do meditation. There are some women who actually add lavender to their diffusers, and they actually, put on their diffusers at night when they sleep, and this actually makes them relax. And some just, try to get an 8-hour sleep. So it really depends on you. But now you can either try any of the 3 things that I already mentioned, or here are some other strategies that you can actually try, and hopefully it can relieve your PMS and your menstrual discomfort. Now, number 1 is pressing away the pain. Now, for centuries, Asian healers have actually used the science of reflexology, which is actually a technique of adjusting the body's internal organs to realign everything, and by pressing on points in the hands, the feet, and the ears. There was actually one study wherein women with PMS and menstrual discomforts underwent hand, foot, and ear reflexology, wherein trigger points were that corresponded to both the uterus and the ovaries were manipulated, and another group was given sham treatment. So meaning they were actually, other trigger points were actually manipulated that did not correspond to the uterus and the ovaries. And it was seen that the women who got the real treatments actually reported a decrease in the symptoms. Is to practice progressive relaxation. Now, a simple way of actually reducing the tension in the body is by tensing up and then relaxing every single muscle of the body. And this is actually one by one. This is actually called, or this is what we call progressive relaxation. And it's very simple. When you're in a lying down position, you can actually just start now tensing the muscles of your feet, and then you hold that tension for a moment and then release, and then start going up. Then after the feet, you work with your calves to your knees, thighs, as you gradually work up, up to the level of your head. Now, it takes about 15 to 20 minutes to work through the whole body. And you will note that at the end of each session, your physical and emotional tension will be substantially reduced. Another way of doing progressive relaxation is actually being practiced in yoga. It's actually imagining that there is a bright light on top of your head, and it slowly actually trickles down like a waterfall on your head, on your face, down to your neck, slowly down until it reaches actually your feet and goes out of your feet. This will take around 15 to 20 minutes also. So you give your body time to really relax and absorb the light that you're imagining. And this will actually make you feel a little better, or at least significantly better at the end of the session. Number 4 is to exercise and combine it with meditation. Now, women who exercise actually experience less PMS than those who are sedentary. And you will actually benefit more from the exercise if it becomes mindful. What do I mean by this? Now, instead of concentrating on what troubles you during the time that you're exercising, you try to focus your mind on your body and every single movement that you do. And in doing that, you're actually now trying to relax. You're actually now helping your mind to relax, and then to be more in tune with your mind, with your body, and so you can now control the pain, and you can control actually how your body responds. Now, how about medical options? Now, there are some women who can actually control their PMS and menstrual discomforts with just lifestyle change and dietary modifications. However, there are some women who just cannot tolerate the pain. And what are the options for them? Actually, medication now can really help. So now, here are the medications that can hopefully make a big difference. Number 1, taking high-dose ibuprofen of around 800 milligrams. It is much better to take one pill that is actually 800 milligrams than taking 4 pills of 200 milligrams each. Now, there is really no scientific explanation for it, but women have actually sweared by it, and they say that it's actually very, very effective. Now, if we cannot control the pain with pain medications, the next step, or the second step, is actually trying to take an oral contraceptive pill to control the pain. You can actually take this for 6 to 12 months with the actually supervision of your doctor, and then we can actually observe how you react to the pill, and then this can actually really just control the level of your hormones, and then this will actually control the pain. There's actually an oral contraceptive pill now that's available in the market that is actually specific for reducing the pain of PMS. Now, there are some women who actually suffer severe mood swings before and during their menstrual period. And this is called premenstrual dysphoric disorder. There's actually now a pill that is specifically formulated to help with this disorder, and you can just ask your doctor about it. And then if this does not work, you can actually try antidepressants also, because a lot of the symptoms or emotional symptoms that are actually being experienced by these women may actually be the same as major depression. Now, if you're experiencing so much discomfort before and during your menstrual period, and it's disrupting you from actually functioning normally, then maybe it's time to see a doctor. Now, mild symptoms of PMS and menstrual discomfort are normal. However, if it actually now disrupts your life, then maybe there is an underlying cause that we need to address. Now, if you've been having depression, anxiety, and irritability for more than 3 months, or the symptoms would actually last longer than the 7 to 10 days before your period, then you may be confusing a major depression for PMS. So it's time to actually now seek consult. And lastly, if you're having cramps together with irregular or heavy bleeding, and your blood actually comes out in clots, there may be a physical problem that we really need to look into further. So it's time to see a doctor. So again, let me repeat. When do you see a doctor? First, if the symptoms are actually interfering with your daily life. Next, if the symptoms of anxiety, depression, and irritability are lasting more than the 7 to 10 days before menstruation or have been persistent for the past 3 months. And third, if you're actually having cramps and are actually bleeding regularly, or you're having heavy bleeding with passage of blood clots, please, please, please now see your doctor. And so I hope this was very helpful. And so this is Doc Mitch saying thanks for watching. Take care of yourself, and I'll talk to you soon. Bye-bye.